Hi, David. Good afternoon. How are you?
I'm doing great. Thanks for having me, Rui.
Absolutely, David. So, welcome to the 150th episode of The Big Unlock. And as I was sharing with you before we started this podcast, Paddy Padmanabhan, had done a lot of the previous ones, and I'm carrying on his legacy. So, David, would you take a few minutes and like to introduce yourself to the audience and talk about yourself and the health system as well, where you have been working
Yeah,
so far?
sure. So thanks a lot again for hosting me. It's really an honor for me to be here with you this afternoon. I am David Berger. I started out as an academic surgeon and an academic surgical oncologist. I did my training, my general surgery training at SUNY Downstate, and then a fellowship in surgical oncology at MD Anderson Cancer Center in Houston, Texas. And I thought I was going to be an academic surgeon, maybe a surgical oncology division chief, maybe a chair of surgery one day, and potentially, eventually, a dean. But really, my career trajectory changed based on opportunities I had. Very early on in my career, I had the opportunity to to undertake a management role, and that was as the chief of the operative care line at the Houston VA, the Michael E. DeBakey Medical Center, which is the largest, most complex, and busiest VA medical system within the whole VA system. And
Great.
additionally, uh, between that opportunity and also being in the sandwich generation, having to take care of my
Yeah,
children, but also having to take care of my parents, I
of course.
really learned how difficult it was to navigate the healthcare system.
Yes.
And if it was difficult for me, who really knows the system, has
Yeah.
contacts, can easily access care, I couldn't imagine what it was like for people who don't have the same funded knowledge that I have and the same access to the healthcare system. So my career goal became to make healthcare simple.
Awesome.
The healthcare system, as you know, is extremely complex. And I
Yeah.
really felt early on, after completing my master's in healthcare management at the Harvard Chan School of Public Health, that digital tools and digital health can really change the way we deliver care and make it more accessible as well as more effective. So I had the opportunity very early on when I was at the VA in Houston to
Mm.
implement some really sophisticated digital health tools. One, the first thing we did was we implemented a tool in terms of looking at real-time location of patients, RTLS, with
Great.
managing our operating room. And we were able to decrease our turnover time by
Mhm.
almost 50%. That means the time between the cases, as well as we were able to achieve almost 95% on-time first case starts, which, as you know, uh,
Mhm.
best
Just
in
fantastic. Yeah.
class, not just VA, but in any healthcare system. And because of our success at the
Mm.
VA, I then went over to the private side and became the chief operating officer at Baylor St. Luke's Medical Center. And there we continue to implement digital tools. One of the tools we implemented there
Mm.
was a tool that helped us, and was using machine learning, so AI
Early on.
before
Yeah.
generative AI, and this is
Yeah.
back in 2014,
Mm.
before the big
Yeah.
hullabaloo and all the recent publicity around AI.
Yeah.
We use machine learning to predict which patients were likely to suffer decompensation as a
Mhm.
result of sepsis, and we
Mhm.
were able to intervene early, and we decreased the mortality from sepsis in our hospital by almost 50%. So between what we did at
Mm.
the VA and what we did at Baylor St. Luke's, I was really convinced that digital health and digital tools, as well as AI and machine learning, were going to
Mm.
revolutionize healthcare. After Baylor St. Luke's. I was offered a job back in where I went to medical school and where I did my general surgery training to be the chief executive officer of University Hospital at Downstate. And that I began in September 2020. And I recently left
Mm,
SUNY Downstate in order to really pursue my passion, which is digital health and artificial intelligence in healthcare. And I'm doing that through advising a number of early stage startups, participating
mm.
in advisories and venture studios. And I'm also about to become an LP in two early stage venture funds that support digital health companies. So that's a little bit
That's
about me and my journey.
that's great, really great to know, David. It is fantastic that physicians like yourselves are taking on this journey because you have such deep domain knowledge, which can really make the change in digital health.
Yeah.
And I did learn from you previously that you also have been an entrepreneur. So could you talk to us a bit about that entrepreneurial journey of yours and the kind of softwares or the digital solutions you worked with?
Yeah, so back probably about 10, 12 years ago, uh, I was approached by an early stage startup company based out of Canada
Mm-hmm.
to partner with them because they saw an article we published on early warning signs for readmission after colon cancer surgery. So we
Okay.
had at least 10 early warning signs, and we had a machine learning algorithm that predicted who was at risk of being readmitted. And this company that was a software company wanted
Mm,
to incorporate it into their tool. So we did a couple of pilots that were very successful, and we were talking about developing a long-term relationship where
mhm.
we, as the clinicians and the researchers, could provide the the key knowledge to
Yeah.
power the intellectual property to power their software. Uh,
Yeah.
we thought they were undervaluing what we were
Mhm.
bringing to the table. So
Yeah.
we actually went to Baylor College of Medicine and
Mhm.
they spun us off as a company, as our own
Nice.
company from Baylor Technologies. So
Mm.
I learned a lot from trying to start my first company. Uh, and all the learnings were not good learnings, but they important learnings. So
Yes.
what I learned is one, if you're going to start a startup, you have to devote all your time to it. You
Of
can't
course.
do it on the side.
Yeah.
So I was heavily involved as a clinician, as an administrator, and I was trying to do this on the side. Second thing I learned is you must have alignment of your board. So we had 5 board members, uh, me, 2 from Baylor, and 2 from the company that was helping us on the IT side, on the tech side.
Right.
Well, the people on the IT side and the people at Baylor College of Medicine were diametrically opposed on the direction, and we got stuck and couldn't move forward. So eventually,
Great learnings, David. Great learnings. Thank you for sharing and being so transparent about it.
so
That,
after about running through a
yeah.
million bucks, uh,
Yeah.
the company died. But
Right.
what's interesting is
Mhm.
that there are a couple of startups that are just getting going
Yeah.
with the idea that we had proposed and we were trying to move forward 10 years ago.
Yeah.
So
Imagine that. Yeah.
so the idea was the right one.
Yes.
The alignment was poor,
Yeah.
and I wasn't uh, committing full time to it. So I think those are really important lessons for anyone trying to start.
Oh, yeah, great lessons learned there. Yeah. And then David, you were talking about how AI is, going to be changing the landscape, and you have a certain way of looking at it, especially especially for healthcare systems. So would love to learn your thoughts about that, about AI, Gen AI, and where do you think it is going, and how one should, kind of embrace it and adopt it to get more value.
So I am extremely excited about the potential for artificial intelligence to help us provide healthcare. Because there are so many repetitive processes in healthcare that are being done by people that probably can be done by technology. Uh, when I think about a health system, and I was running a hospital, about the different places where artificial intelligence could have a major impact, I break it down really into four different areas. And this is general, there's overlap. So the first one is obviously back office
Yeah.
functions, things like revenue cycle, uh, coding, billing, documentation,
Mhm.
pre-authorization, all those things that have to do with revenue cycle. Then I look at the front end or access, giving patients the opportunity to uh, interact with a provider, giving them the opportunity to schedule,
Mhm.
how they're going to pay for their healthcare, et cetera, et cetera. So the front end things. And then on the care delivery things, there are things that help make care easier to deliver. And then there are things that actually help provide care. So let's break down those two things. So when I say make it easier to deliver care, I'm talking about things like uh, artificial intelligence scribes or ambient
Mhm.
listening, ambient dictation. When I talk about things that help actually deliver care, I'm looking at adjuncts to helping read X-rays. So
Mhm.
one use case that's fairly well developed is the issue around mammography.
Mhm.
So an important fact and things that radiologists look at in mammograms is breast density.
Mhm.
Breast density
Mhm.
sometimes will predict further cancer down the road.
Yeah.
Radiologists are really bad at quantitating breast density. And there's a total lack of correlation from one radiologist to another.
Mhm.
But using artificial intelligence, you can improve the ability to determine breast density to almost 95% accuracy. So that is a place where artificial intelligence could augment care and improve uh, how care is delivered and the diagnostic accuracy. So that's what I mean when I say help facilitate care versus actually help deliver care.
Understood. And David, in particular, like just for a moment to segue into all the new generative AI technologies that are coming our way, and it's not just about text, it is also about so many different forms of media that it can transform. So, any thoughts that you have where you think, generative AI might play a larger role or might be more conducive in the healthcare setting?
Yeah, so in terms of generative AI, one of the solutions we implemented is something called AVO, AVO.
Mm-hmm.
And what AVO does, it is ambient listening,
Mm-hmm.
so it helps physicians to write the note, but
Mm-hmm.
that's part of it, but that's not really generative AI. What it
Mm-hmm.
then does is it pulls relevant information
Mm-hmm.
from the electronic medical record
Mm-hmm.
in order to create a real functioning note,
Mm-hmm.
puts in front of the clinician a differential diagnosis as well as the clinical pathways related to that clinical diagnosis. So yes, it's ambient listening, which is important, but it's also
Yeah.
natural language processing. And then
Yeah.
it helps to generate a differential diagnosis and then helps to generate the proper treatment pathway for that patient and presents the note in a way that facilitates the coding, the billing, et cetera, for the hospital or the system to be able to get reimbursed. That has been a game changer for our
Hmm.
clinicians. And thinking about implementation
Yeah.
of any new tool is really, really challenging. What we found with the ambient listening and the ambient dictation, there was a different level of adoption
Hmm.
between specialists like surgeons
Hmm.
versus primary care doctors.
I see. That's interesting. Yeah.
Why do you think that is? I'll throw it back at you.
I couldn't even guess that. First of
So
all, I'm thinking to myself that is it the primary care physicians who adopt it more, or is it the yeah, so it's the
it's
other way around.
it's the specialists and the
Yeah.
surgeons who adopt it more readily. And
Hmm.
because to them,
Hmm.
a note is something you have to do. It's that's not really what they
Hmm.
want to do. They want to do
Yeah.
their operation, their
Yeah.
procedure, et cetera, et cetera.
Yeah.
So note is a barrier for them
Yeah.
to be able to do what they really want to do.
Right.
As for a primary care doctor,
Hmm.
the one of the primary goals that they have is to create a detailed note.
I see what you mean.
So to them, the nuances around creating the note are really important.
Mhm.
Whereas for a surgeon, they just want a note.
No, I see
They
what
don't
you
care as much
mean.
if it's
Yeah.
perfect. They just
Yeah.
want to get it done. And so the adoption was much quicker with the surgeons than it was with the primary care. We also were implementing it in the emergency room,
Hmm.
and the emergency room is a tight space with a lot going on.
Hmm.
So some of the ambient listening got distracted because of other
I see. Noises.
noise
Yeah.
within the
Yeah.
space. So we had to figure out ways of making sure that during the interaction between the clinician and the patient, there
Mm.
was uh, as little ambient noise as possible. But we worked through that, and the adoption was incredible. So
That's great to know. Hmm.
and people have talked about AI replacing physicians. So 5 years ago, there was
Hmm.
uh, uh, someone came out and said, within 5 years, there's not going to be any need for radiologists. Well,
Mm.
clearly that hasn't happened.
Yeah.
The way I see AI being used as an adjunct
Yeah.
to clinicians and helping them to be better at what they do
Hmm.
in terms of doing it more efficiently, but also helping them be more accurate in how they provide care and make diagnoses. So
Absolutely.
I think
And
I think clinicians are going to become partners with
yes.
artificial intelligence. And the other place where I think
Hmm.
AI, generative AI, augmented reality, virtual reality is going to have a huge role is in education.
Yeah.
You
And
know,
you do teach. I did see that you teach as well, David, right?
right. So
Yeah.
even teaching in the operating room. So right now, the way you teach in the operating room is you work with a resident across from you, and over time you give them more and more experience and more
Yeah.
uh, freedom to conduct the procedure. But think about if you have really good augmented reality, you can
Mm-hmm.
have them work with a headset in an environment outside of the operating room and hone their skills
Yeah.
in an environment where there's not potential risk to patients. So really amazing opportunities in augmented reality and virtual reality in education, but also in surgery. So let's talk about one of the things I used to do is I used to
Hmm.
do a lot of liver surgery.
Okay.
So the way we used to think about it, so obviously the liver is a three-dimensional structure, but the inputs in terms of where the vessels are, where the tumor is, uh,
Mm-hmm.
come from 2D images, right?
Mm-hmm.
From two-dimensional images, from CAT scans, from MRIs, from ultrasounds. And then once you're in the operating room,
Mm-hmm.
trying to put that 2D uh, image and reconstruct it in your mind into a 3D picture, and then
Mm-hmm.
how it relates to that organ in front of you
Mm-hmm.
is a challenge, and you get
Yeah.
good at it over with experience. But
Mm.
using augmented reality now, you
Yeah.
can actually see right in front of you where that tumor is in relationship to the other structures within any organ, and facilitate surgery. That's been really well developed in terms of neurosurgery, but that's a
Yeah.
really exciting opportunity for AI, virtual reality, augmented reality.
Yeah, great example, David. So my last question is around David, your new venture or your new role that you're going to be taking on soon, as you described it in the beginning of this podcast. So which aspect are you more excited about? Because you've seen the startup side of things, and now you've been in a large health system. So, where are you thinking that you will be spending more of your time and, you know, being able to add value? Yeah,
So I think healthcare is slow to change from the inside. A number of the bigger systems have developed innovation labs and are trying to move the field forward. But I think a lot of the change is going to come from from companies outside of healthcare.
I see.
What I've decided to do is move away from running a healthcare system or hospital to being more involved in the actually digital health and AI ecosystems. And
Great.
I think the way I can best contribute is as an advisor to
Hmm.
early stage companies within the space, but
Hmm.
also as an advisor to investors and venture companies that are looking at what are the different technologies that are actually going to make a difference. And since I have the lens of a clinician as well as a operator within the health system, I think I bring a unique uh, lens to the question of which digital health solutions are really going to make an impact.
Awesome opportunity, David. Wishing you all the best, in this role. And then, would you have any other closing thoughts for our audience?
Yeah, so I think we are at an inflection point
Mhm.
between technology and the desperate needs of within the health system. The costs have risen dramatically. People do not have adequate access, and there are huge problems within our health system. I think we have a huge opportunity right now to make a difference and to move healthcare forward and to improve the healthcare system within this country. And I encourage people who are thinking about careers within healthcare to think about the innovation side and the digital health side, because that is really going to have a huge effect and move the needle.
Thank you, David. That's a great closing, and I'm hoping to partner with you as well. So, thank you
Oh,
once again. And
and
I will turn off the recording now and we can chat for a few minutes.
well, thank you, Rohit, for inviting me. I enjoyed the conversation, and I look forward to continuing uh, that conversation.
Likewise, David. Let me just pause it now.